else. So again, so you're on medication. How have you been able to manage or control, from your end? And of course, Dr. Kevin, I can see you have the machine, so I think maybe we can do we can do the check and see how you're doing. But how are you doing now?
So far, so good, I can say.
Yeah.
Since it's how many? Since 2018 on the medication. This is around 4 years now.
Yeah.
Then again, of course, with the doctor's advice of weight loss and diet.
Yeah.
So to me, exercise is the most thing to me.
Yeah.
I do lots of exercises. From my place of work to my place of residence, I do a 1 hour, 15 minutes walk.
Nice.
Every day.
Wow.
In the morning, especially.
All right.
And in the house.
Yeah.
Every day in the morning, I'll wake up, do what are they call aerobics. So I'll do the aerobics in the house for like 25 minutes. Prepare to work.
Okay.
So that has kept me like with the medication and the exercise and the diet.
Yeah, that has helped you control.
Yeah. So at some point, if I tell someone that I'm hypertensive, like
nobody will believe.
You're not. Like acha kujiekelea vitu zingine.
Right.
Yeah.
Right.
But,
okay. Yeah. And I'm happy that you're okay now in terms of managing and controlling your BP. But the cost aspect is what I'm curious about in terms of accessing to your medication.
The cost aspect was the first thing that when I declined taking the medication at first, that is what came to my mind.
Yes.
So I'm like, if I've got 1,000 shillings and half of it goes to my medication, and half of it for the food, I've got a family to look after.
Yeah.
That is the first thing that came to my thoughts, and I said, no, I'm not going for the medication. So I didn't want to juggle between my 1,000 bob, going for medication, and feeding
also
my kids.
taking care of your family.
Yeah. So that was the first thing.
It's a gamble.
Yeah. But after some time, after maybe being into yourself and coming back to yourself and thinking about your health, you are thinking about these kids and food. You don't know. You may not wake up in the morning. Because I remember the doctor telling me at Kikuyu, you are the kind of people that will go to sleep with the 205 and don't wake up in the morning. Because you don't feel anything, you don't feel any pain, you don't feel anything, and you go to sleep in the evening and you don't wake up in the morning, you wake up dead, and you don't know what killed you, and no one knows what killed you. So I had now to, for the sake of my kids and for the sake of life, I had
to the medication.
Yeah, I have to pay for the medication. Okay. So in the dispensing chemists, maybe, or in the private hospitals, or some of the clinics, or around where we live, the medication is quite expensive.
Quite expensive.
Very expensive.
Yeah.
So you'll get like for a month dose, we have like 30 tablets for 1 month. So you'll get this at around 900 shillings. And here I have 1,000 shillings.
Yes.
So of course I wouldn't buy them.
To gamble.
But when I was introduced to the health center, the Westlands, we have a health center in Westlands, which is a public facility. So with them, they had this thing covered partly by the government and partly by the hypertensive people, which is like a support group for hypertensive and diabetes people.
Oh, that's good.
So with that, we get it at a subsidized price,
that is good.
Which is not so heavy on us.
Yeah, on you.
Yeah.
Okay, that's really good to hear. Okay, so Dr. Kevin, as you, is that okay? If we can take your blood pressure, that's fine, because we have to ask. Okay, so Dr. Kevin, as you do that, very quickly, let me just take the parting shots. And I'll start with you, Dr. Nasirumbi, in terms of fine. So the government is trying, just to make sure that the medicine is available and easily accessible, but then again, at an affordable price. But in terms of, like moving forward 5 years from now, what do we hope to see as far as hypertension is concerned in the country?
For me, where I see it is...
Dr. Kevin, I think we can go ahead. Yes. We've got multitask. All right, go ahead.
Is to look at these risk factors that are leading to higher chances of getting hypertension and other NCDs. So Dr. Ndede mentioned lifestyle, physical exercise, the food you eat, nutrition. There are other areas that we also look at, these modifiable factors, where we have tobacco smoking and alcohol, you know. So those are the things that we are looking at to minimize on this, because these are the things that these are the factors that lead to hypertension. So if we can do something on the risk factors, we can really protect this younger population who have not yet gotten hypertension. And even those who have gotten hypertension can easily control and manage it. So we have interventions where we've done as a ministry from legislation and regulations of some of these modifiable factors. Just to mention a few, we have legislation on the tobacco use, prevention or prohibition of tobacco use in public places. We also have upcoming regulations on trans fatty acids, which are industrialized fatty acids that increases the chances of getting coronary heart disease. And then we have also legislations coming up on sugary and sweetened beverages, which are also risk factors. So just to mention a few. So in the next 5 years, I presume that you're going to have lower numbers or a lower prevalence of overweight and obesity in our country, increase of physical activity, cessation of tobacco and alcohol use. So that's what I envision and see in the next 5 years.
All right, thank you very much. And of course, Wangeshi, very quickly in terms of then broadening access, you know, to medication, what would you say as Novartis, very quickly?
I think Novartis has played a significant role in ensuring that we are looking across the income pyramid and trying to expand access so that patients of all walks of life can have access to quality medication. And like I mentioned, the Novartis Access Program has been a pillar for us in terms of ensuring that patients can access quality medication. But in addition to that, both Dr. Nasirumbi and Dr. Dede have mentioned a lot of partnerships are required in order for us to be able to shape the environment. And this is a key pillar as far as Novartis is concerned. In addition to that, maybe lastly, one of the key things that Novartis is really focused on is also building capacity when it comes to upskilling healthcare professionals, those who diagnose, and also when it comes to helping with diagnostic tools. So this is a key area for